In another development, federal government has officially flagged off distribution of medical equipment, essential drugs, and other health commodities to states across the country in a major move to strengthen the nation's healthcare delivery system. The flag off ceremony, which took place in Abuja, was presided over by the coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pati, who emphasized the federal government's commitment to improving access to quality healthcare and ensuring that all Nigerians benefit from recent reforms in the health sector.
And this intervention from Nigeria's federal government as well as Friends of Nigeria is meant to reach the people, the women, the children. We have to ensure that every one of these resources, whether it are the drugs that we have seen, the antibiotics, whether the medical equipment that has been provided, is used for the intended purpose, just as we have been doing for the Basic Healthcare Provision Fund, because we send the resources to states and to local governments. We want to make sure that there is no official that takes this equipment and then goes to sell it to the market or diverts the drugs that are meant to reduce the cost of medicines, because Nigerians are facing high cost of living, including cost of drugs.
Also speaking at the event, Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency, Dr. Muyi Aina, highlighted some of the agency's recent achievements, noting improvements in routine immunization, maternal and child health care services, and community outreach programs.
To date, sir, we have 1,295 primary health centers that have been completely refurbished in terms of the buildings. We have installed in 38 PHCs across the country solar power, because they had everything else and just needed solar. We are also working in partnership with the SWAB office as well as our sister agency, the NHIA, to revitalize CMONG sites. And we have 20 comprehensive emergency obstetric and newborn care sites that are currently being revitalized. As you know, sir, we have a live functional PHC dashboard where, at least on the primary healthcare side, this can be tracked. In terms of distribution, the 1,295 PHCs are slightly weighted towards the northern zones.
Dr. Aina said delivery of the medical commodities will help to bridge critical gaps in service delivery at the primary health care level, especially in underserved areas.
We have 56 different primary health care relevant medical equipment here. They include heat ovens, incubators, diagnostic equipment like binocular microscopes, autoclave machines, delivery beds, portable ultrasound machines, and all. All in all, we have bundled them into the complement of equipment that each primary health center will need for to be level 2. And we have enough to go to 500 facilities across the country. We have selected facilities across the 36 states and the FCT, Honorable Minister, that prioritizes revitalized primary health centers. PHCs that the NPHCD and the federal government have directly revitalized, we feel an obligation to make sure that we support them to be fully functional, so we are equipping those.
Lead of the sector-wide approach for maternal, adolescent and infant initiative, Dr. Dayo Adeyanju, who also spoke at the event, underscored the significance of the distribution, noting that it aligns closely with President Bola Ahmed Tinubu's renewed hope agenda for the health sector. The distributed commodities include maternal and child health kits, cold chain equipment for vaccines, essential medicines, and emergency obstetric supplies. According to the coordinating minister, states will begin receiving their consignments next week.
The women are happy across these 21 states that we have gone for a deep dive. They are really excited with the free cesarean section and then the emergency transportation of the women. So today, again, this is another support to really strengthen and reinforce our determination to crash maternity. We are super happy to be here as this is happening. I really want to thank you for leadership and thank the ED and the entire team for this good work. I'm pleased, to say that we also will see how this will begin to reach the last mile and ensure that the women's life and the children are safe.